welcome to Mercy TV, the Coronavirus Edition, Episode 2. We are here filming in a disclosed location. We're not going to disclose it where, but it is disclosed, I suppose, to various places.
We're safe at home.
We are sheltering in place here. Hello, greetings. I'm Perry Normal, and along with PK and Sunny,
hello,
we'll be hosting this segment of Mercy TV.
Courtesy of CCTV of Salem.
Thank you.
Thank you.
Thank you, CCTV.
And all of their employees.
And we hope are being safe as well.
Yes, and all their families.
Taking care of loved ones.
And the people at the hospital.
And the doctors.
Talk to your doctors about cannabis. You don't have to smoke it.
Well, doctors and nurses, all the folks on the front lines dealing with this very real, very serious thing. God bless them and be with them. Our thoughts and prayers definitely with the first responders and all the folks in the medical care profession.
Well, I think it's something you can talk with all of them. Talk with all of them. Cannabis is something that's healthy for all of them, and you can talk openly with all of them.
Right. Well, as far as the coronavirus and cannabis, medical cannabis, the one question, of course, as folks have is, can medical cannabis be used to treat coronavirus or even prevent it? And I don't think we can say that. Certainly, since the coronavirus is a respiratory illness, you want to reconsider smoking cannabis for your medication methodology.
But at one
Good news is,
at one time, the athletes that were marathon runners would use cannabis to help them. They were even for asthma.
right.
Also.
So cannabis has been used for other respiratory ailments, and it's not out of the realm of possibility.
Well, they were eating it. They were eating it.
Right. Well, that's
and
another
rubbing
thing.
it out topically.
No, they were actually smoking it. I don't know if you remember Dr. Todd McArea was a very famous California-based doctor, but back in the 1950s when he first started interning as a physician, he was at a veterans care facility and smelled cannabis, and after tracking it down, came across a man who was using it for his asthma. Yes, back in the day, before cannabis prohibition,
1937.
cannabis was used in a variety of ways, and one of them was for asthmatics and other respiratory things. The reason being that it opens up the lungs, it expands it so you can actually breathe clear. It gets a lot of junk out of your lungs.
You got a good cough and a bad cough.
So that's one. Can it be used to treat it? We don't know. Can you use it while you're, during this time, if you're concerned about it, whether you have it or concerned about getting it? And I think the good news is that you don't have to smoke it to use it, to medicate.
Well, it's something definitely you want to talk to your doctor about.
Right, yeah. I mean, if you're considering using it for whatever purpose, sure, and how you're using it, saying, I don't have to smoke, doc. I can eat it. I can apply it topically. We can rub it on.
The parents should be talking with their kids, and the kids should be talking with their parents.
Here, here.
These are the conversations that we should be having. That's why education is so important.
Very true.
And this is what we've been pushing since 2002.
Right, yeah.
And thank you, CCTV.
Yeah.
Thank you for Dank down in Eugene, where he has a show, Cannabis Matters, I believe is the name.
And I did talk to him the other day, and there's a show, and they're having, it's just, they're having it,
They're still doing a show?
Well, he said he was going to talk to Kevin, and he told me he would talk to Kevin, and we never finished that conversation because somebody came in on the phone and he would get back with me. He told me to tell you guys send his love, and and I never got back to the phone, and my battery was dying. And so these are the things that go on every day. You guys expect to the cannabis is good for us. Talk to your doctors. This is what we want to do.
And there's a lot of different articles on the benefits of cannabis, and you can easily look it up on your phone, asking.
Well, and with this coronavirus going on, everybody's got a lot of things going on. They should be able to get it on the tablets too, right? Yeah.
Well, the internet's really burdened right now, so a lot of folks are working from home, and so we're really stretching the bandwidth of the net. But I think folks can certainly find that information out. They're not going to go to the library, unfortunately, like they used to, I'm afraid. And there's unfortunately, not a lot of good solid information in the libraries about cannabis, especially medical cannabis.
The medical cannabis is a really good, we want to start with the most expensive information we can find out that people are going to be pushing, that they're going to say that, hey, we know that it's medical cannabis. Well, you know what? Who says it's medical cannabis? Ask your doctor. Your doctor is the one that is the medical. Medical is your doctor.
Yeah.
Doctor makes it medical. That's why it's medical.
Well, he's the one that signs for it.
He's the one that'll ask you to take pharmaceutical drugs, which may or may not have the side effects that were beneficial for the body.
Well, what makes it medical is the fact that it has a medical application. To be an official medical cannabis consumer, you need to get a doctor's signature on your form. But that's just the freaking state, and they're allowing you.
You're paying protection.
Protection, right? This is supposed to protect you from getting your pot taken away from you and the crap beaten out of you by police officers.
And your house seized and that.
All that, your house, your car, everything seized, your children taken away from you, la la la. That's what getting the medical cannabis card in Oregon does. Unfortunately, it gets you no support. It gets you no information about cannabis as medicine, how to use it, how to grow.
They don't do any research.
How does it apply? I mean, how does it work and all? No, it's the worst, program in the nation in terms of recognizing that cannabis is medicine and making sure everybody who should have it gets access to it.
And we paid the highest cost to have this protection money in the state.
Right, and that's what I mean. Like no other medical program, has this basis. Any other program, it talks about how this medicine applies, alternative modes, getting rid of the disease in general, and things of that nature, and not with this, It's the hypocrisy, the double standard, just goes to show that all the nonsense that's around it is politically. It's not scientific, it's certainly not medical,
It's only for the money.
Money.
People were going to
money.
lose money, and people were going to make money.
Case in point, marijuana is evil, it has no medical value, they kept hammering on that. Then the information about CBDs came out.
Well, now they got corona.
Well, the CBDs, the cannabinoids, and that was poo-pooed, and all of a sudden, but then some rich white people could make money off CBDs, and all of a sudden it's okay, you know, it's everywhere. It's in the corner plaid pantry, you know, now. And so it's just, you know, you can't see these hypocrisy, this double standard stuff going on and still take the whole cannabis prohibition thing seriously. Certainly the reefer madness, you know. Cannabis doesn't kill, you know. I think, can we stop that nonsense that people are gonna, or drive you mad so that you're up on the rooftop shooting people or something, you know, that's, you know, it's just not the behavior of people on cannabis, overdosing or otherwise. You know?
No, cannabis does not, but Corona does. You know, see, these are the things, and cannabis is healthy for you. You know, these are the things we're trying to teach. You know, this is what we're trying to teach. And this is what's good for you and what we want, you know, education.
Yes.
The education is good.
Right. Education, good. Education, our friend.
And Corona is bad.
It's definitely bad.
Well,
But a lot of diseases are bad, you know.
well, and that's why it's time to take time to learn the education. What's, you know, and
You know, and not, but then take this education that affect policy, you know, affect process, you know. It's because we allowed our nation to be ruled by folks like cannabis prohibitionists that we're facing this, there's all this hardship with this virus, with this disease. Too many people who don't believe in the science playing a role in medicine, who believe in other factors, morality. You know, you should only have medicine applied to you if you're morally good and worth it. You know, a lot of people make that kind
Have
of
the money.
obscene, yeah, which is how that translates. You know,
the plant grows good.
makes that thing. And so, because, you know, cannabis prohibition is where medicine and science and truth, accuracy, kind of parted ways. Cannabis prohibition is where the state learned to lie about things, you know, and because that, we came to this point here where we needed the truth about it. We needed things done for the health and safety and well-being of people, and no other factors. And that's all, every other factor was in there, applied, just like cannabis prohibition. And so, you know, maybe this is a good time to evaluate our policies and processes and procedures, that things are made illegal and things are considered seriously and so forth, you know.
Well, we have to take the time to know that the
Know
education-
ourselves,
Yes.
right, yeah.
Well, and you know what? Pass it on. Pass it on, girl. Pass it on.
Educate your friends, your family, your neighbors, your co-workers, you know.
It's important. It's important.
And participation is the main cog in the development of better laws for cannabis.
Right, I mean, these bad laws came about because nobody attended the hearings where they put these bills through. Nobody contacted the legislator and said, no, don't freaking do this.
At one time, I did film these hearings that I was able to film and bring to the public, courtesy of the CCTV.
Right, check our archives, but notice we don't have any up there as we used to. In some cases we haven't been able to post them, even though we've gotten them. And some cases we haven't been able to get the show. They didn't tell us that the hearing was going on. You know, relying on our network of activists, other media people like Dank the Bagman and Paul Stanford and his group,
And Anthony Taylor.
Anthony Taylor, Anthony Johnson of Compassionate Oregon. It's also necessary for this. So hopefully, you know, the movement will coalesce more folks will volunteer and come forth on the other side of this. Of course, it's really tough to get together. The whole gatherings nowadays,
Gotta
you
have
know.
our own hip fest.
Which brings us to the Million Marijuana March, which is happening first Saturday in May.
Second.
It's the second, May 2nd this year. That's J-Day, and that's where several hundred cities around the globe all have a march or rally on the same day. And Salem's entry is happening, that's Saturday. Some places will have it on a different day, but around there. Some have it on 420, you know, and so forth. So kind of an ongoing thing. And folks need to stay tuned to our website, mercycenters.org, for more information on it. If if they continue to discourage public gatherings after April 28th, like they were saying, we'll have to see. We'll have to have our little march and rally with little places, you know, everything marked out in chalk. You know, folks can stand a certain distance apart. But the important thing would be to get out the message, you know, that the global cannabis liberation, cannabis reform movement, you know, is very real, very active, and is a resource for people. Because, you know, that's where we find out things like growing tips, and cannabis can be used for certain ailments, and how best to prepare your medicine for that ailment. You know, some illnesses lend themselves to a certain application, like cirrhosis, skin conditions, others, the topical applications. Psoriasis, burns, you know, injuries of that kind, as well as diseases.
Wasp and flea stings.
So, all kinds.
Works on your dog. So I'm preparing a joint, a cigarette. I cleaned the cannabis with a grinder and a box. It's not Sinsemilla that we have here.
It's not seedless.
I could roll it by hand, but I found the machine is a lot easier to take care of the situation.
Does a lot better job.
So, that's the main things, I guess, that we're here continuing to do our shows as well as other action items. Folks, give us a contact by visiting our website, mercycenters.org, and try to send us an email or leave a phone.
You give a call?
You can give it a try. Hopefully we can get someone to the phones to answer people. Here.
Participation.
So, as we talked about, we need to change policies and change the people in position for, you know, taking care of business like this. And to do that, we need to change leadership.
Sure.
Right? Is that, I mean...
That's registering and voting and talking to your neighbors about what's on the ballot in your neighborhood.
Yep. Because it's important that every single person who is eligible to vote does so. And not only does that, but encourages everybody around them to do so also.
And don't be afraid to get in touch with your legislative people and tell them that they're doing or not doing a good job.
Right.
They need to hear from you.
Yeah, you want to, you know, find out where your legislator is on it, and if they're not, if they are, you know, following your wishes on the cannabis issue, then vote for them and encourage others to do so. If they're not, don't, and discourage, and find out whoever their opponent is and join their effort.
Well, to see if he's any better, too.
Well, yeah, hopefully. So the bottom line is vote smart. You know, Sonny was saying, educate yourself on who your representative is, and what their stance is on the issue, and their points. You know, why do they have this? And
We learned so much, didn't we, Perry, when we went down there and changed the law? I mean, do they change their vote? They say they're going to vote one way, change their vote when they do their... God, just when you guys just said that, I just had like flashbacks and shit. Well, because they say one thing and do another. Say they're going to do one thing.
Catch-22.
Man, you guys, it just... God.
And then they think it's okay.
God, and yeah, that's bullshit, you guys.
And that goes along with crap like walking out of the session.
You guys,
You know,
so
just
much
quitting.
bullshit.
You know, how do you get to keep your job after that? You know,
Because they can,
So-
and they get paid.
let's not let them keep their job. Vote these people out. You know, on that basis, or how they voted on cannabis prohibition, or any other metric. You know, how you think they're doing on this coronavirus issue.
Well, they should have the 3 strikes rule. If they don't do their duties and leave their office, you do that a couple times, you can't vote or be elected as our leader.
Yeah, really. You know, any kind of enforcement on any law for the rich and powerful. You know, legislators don't pay any penalties even by their own rules when they break the rules or even the law. Certainly rich people don't have to, you know, laws are for little people and kind of thing. So,
Well, the rich people
Like,
don't get
especially
hurt.
tax laws, you know, the monies and shit. So, yeah, we got to change the leadership, change the laws, and change the lawyers, as it were. The ones that are now in the place of legislators and determining whether or not they're going to enforce it or ignore it. You know?
Propaganda about the cannabis and the hemp. We must change.
Well, I mean, that's how they got these bad laws that we're suffering under through, was propaganda. Each and every time there was a collection of downright lies and falsehoods, inaccuracies that was presented as, quote, testimony.
And what research has been done on the cannabis hemp plant has been silenced.
Right, well, they won't allow any, you know, and they stymie it in various ways, you know. And it's a shame. People are dying as a result, literally suffering and dying. You know?
Don't forget to use your hand sanitizer.
Right? Or your cloths with all the good stuff in there to disinfect.
Washing your hands all the time.
Yep.
That's what's important. Washing your hands all the time.
That's it.
And
Good
don't be afraid to use the moisturizer after using the hard detergent soap that you may have used to wash your hands with.
Yeah.
It's just going in and out of the bathroom, going, you know, when you're doing work, going in and out of the bathroom, all these different things. When you wash your hands with soap, you know, I forget how many times we were sitting down counting it out. It's a whole bunch of times. That's, you know, covering your mouth. There's a whole bunch of things. Doing the sanitizer, you know.
And these are not new things.
No,
you know?
exactly. It just
So-
didn't start
Time
with
of courtesy.
Corona.
Right. You know, I think it's just going back to, you know, some kind of basic protocols that really should have been doing during flu season and stuff, and I'm sure some people do. Now there's a lot more impetus, I guess.
And these are the things that we're paying attention to. These are the things we're paying attention to a lot more now that the corona is here. So now, you know what? Education in cannabis. Cannabis.
It's 5:41, so we have 4 minutes left.
Cannabis. Cannabis. Now that cannabis and corona, you know, kind, cannabis, corona. Clean, kind.
The kind.
The kind.
COVID 420.
There you go. And everybody knows, you know what? These are just things we're doing with education, and we can do that at Mercy and CCTV, and thank you. And all these things we can do. And just give us a call, and if you got any questions, give us a call. We can do that.
Right. Visit our site.
And thank you for watching this program. Thank you for Mike. Thank you for Shauna. Thank you for Grandma Janet. Thank you for all the Mercy members of the Mercy Center. We still need your help and participation. My garden will be starting up soon, my friends. Anything else, my buddies?
Register, vote, and get everybody you know to do so also. And make sure that we get to the polls. Don't just say, okay, I've registered everybody. Make sure they get to the polls.
Well, and be talking with your family and friends and neighbors.
So they vote smart.
Well, these are the things you want to be talking to them about. You know, these are.
Along with getting your card, you know, getting good medicine and helping those who can best benefit from it.
Well,
to
see if they
have
can,
access
if they
to it.
need a ride.
There you go.
They might need a ride.
Just that simple.
Because these are things, you know, they might need some medicine.
Right on. So
You know, these are little simple things.
keep the faith. Don't be afraid to share.
Right.
But
the
share
faith.
safely.
You know what? Keep them in your prayers, please. Keep them in your prayers. You know, these are things. Thank you, Lord, every day.
Amen.
Thank
Okay.
you.
Good night.